Okay, let's get started. Then let's inform everyone that the meeting is being recorded and ask you to keep your, unless you are a presenter, please keep your audio on the mute. So let's get going. Good afternoon, everyone. Welcome to the COVID-19 briefing and the question and answer sessions organized by the ACOBA East Coast. We have a panel of 4 eminent doctors here today who will be sharing their experience at the forefront of this battle. The effects of the pandemic are not limited to healthcare issues, though. We are very happy that Their Excellencies Ambassador Rodney Pereira and Ambassador Shenuka Senivaratne are here today with important messages as well. We will begin with their remarks. His Excellency Ambassador Pereira.
Thank you very much.
His Excellency, could you please present your remarks?
Yes. Can you hear me now?
Yes, Ambassador.
Okay. Thank you. Good morning to everyone. Thank you for this wonderful initiative. I salute the Ananda College Old Boys Association for putting this very important discussion in place. And thank you all for participating from different parts of the country as well. This is a trying time, needless to say. In Sri Lanka, we are also continuing the fight against this, and the government there has fared somewhat better in terms of numbers. But we are all faced with this challenge in the months ahead as well. So I thank all the medical professionals. I know many of you are volunteering to provide valuable information to our Sri Lankan community throughout the United States. So I salute all of you for giving your valuable time and guidance, because this is a situation where there is no cure. So words of advice, words of guidance, words to heal is immeasurable. And I think this is something I, as the ambassador on behalf of the Sri Lankan community, want to salute our medical professionals who continue to do this. So thank you all very much. And we as an embassy, we continue to appeal to our Sri Lankan community to register through the Contact Sri Lanka website. For those of you who want to go back to Sri Lanka, be it students or temporary visitors or others, continue to stay in contact with the Sri Lankan Embassy in Washington, D.C., the Permanent Mission in New York, and our Consulate General Office in Los Angeles. Give us all the details. Be in touch with us. We are all manning telephones 24 hours a day. If you have any queries, if you have any accommodation issues, if you have any other concerns, please call us. We'll try our best to give you answers and assistance. And I know many Sri Lankan associations have commendably come forward to assist the Sri Lankan community in need. So let us continue to join hands and serve our community. So thank you all again, and I look forward to a full discussion today.
Thank you, Ambassador. Now we join the United Nations mission in New York for Her Excellency Ambassador Shenuka Senivaratne's remarks. Ambassador Senivaratne. Okay, it seems like we have a connection issue with Ambassador Senivaratne and the New York mission. We should be able to get back to them later. We are going to start the panel discussion now. The format is going to be the 4 doctors, Dr. Nadaraja, Dr. Vimalavansa, Dr. Kotahachi, and Dr. Marambake will make initial presentations, brief remarks about their experience in the forefront of this battle. And once their initial remarks are done, we will have a question and answer session where we will be looking into your questions, which you can type into the chat, and the doctors will take turns answering them. We will begin The first doctor to join our discussion today. He leads the COVID-19 task force in the AHS Western region. He has been recognized just this last week as a real-life superhero for his work. Thank you, Dr. Nadaraja, for joining us today for a discussion which you intend to begin with the symptoms and signs of COVID-19. Dr. Nadaraja.
Thank you, Dr. Bernard. I want to start off by saying that we have all been affected in one way or the other. And starting off, when we're thinking about COVID-19, it seems many, many miles away that these things were happening in China, Wuhan, and nobody really thought that we were going to be dealing with such a pandemic in such a short period of time. I must say that things have really moved on, and we are in a better place, and we are continuing to get to a better place as time goes on. We all had major fears about this whole pandemic. People were thinking about bunkers. They wanted to hide in a place where so that you couldn't contact anybody else to get the disease. And as time moved on, we are becoming more and more resilient, and we are going to continue to be resilient. And we will continue to improve the treatments as well as find ways to overcome this pandemic. I just want to reassure everybody that we all started off with great fears, and I think as we'll find out throughout the meeting, we will continue and find ways to heal ourselves. In terms of the signs and symptoms, I wanted to just kind of highlight, and I'm sure if you have been able to see all the information online and on all the television channels. The primary thing one has to take away is that the significant number of patients do not have any symptoms. 80% may have, the main thing to watch out for is the fever. A majority of patients, when they become symptomatic, they will have fever, which is 99% of the patients, and that's when they have a temperature more than 100.4. The next one that is also is fatigue. If you feel weak and lack of energy is one of the other major symptoms that we can find based on the Chinese data and what we found here. Dry cough is the next one, 59%. And the next symptom that you have to think about is loss of smell, taste, and appetite. These are about 40% of the patients experience that. Generalized body aches, it's another symptom that has been seen more frequently as well. And then there are some other minor symptoms, but pretty much these are things that you will experience in the beginning, and the timing as to when you get these symptoms can vary. Some people may experience a fever as their starting symptom, others may have just generalized body aches. So it depends on the individual as to how they what they experience. Shortness of breath is a telltale sign that you need to watch out for. So majority, 80% will get over. They may have symptoms, but they will not progress to any further deterioration requiring hospitalization. So I just want to make sure that majority of the people who experience these symptoms should stay at home. As I'll point out, just take precautions and distance yourself, and also quarantine yourselves. As far as the rest of the symptoms that will then prompt you to seek medical attention, one has to be aware of, and then the shortness of breath, one. Other symptoms also in the US, we also noticed diarrhea and vomiting, redness of the eyes, a rash on the toes, which is called a COVID foot, and skin rashes on the body. There are also some who may experience headaches, and some of the other less likely symptoms. Chest pains have also been reported by some patients. Again, these may be associated with shortness. So those are symptoms that one needs to watch out for. Now, this is an example of a COVID toe, which you might have seen. It's a redness on the tip of your toes. If that's experienced, multiple things can cause this, but this has been identified in some of our early patients that we've seen where they develop blistering and redness. It's an ischemic episode where the circulation is affected by the infection and leads to this type of findings. There's also a rash, which you can notice, as you can see here, which can be distributed throughout the body, in the chest, the arms, and the abdomen. So these are things that are noticeable to a lot of people, and doesn't take much to figure out. This might require further attention. As I mentioned earlier, 80% will recover without going to the hospital. So important thing is to take appropriate measures. Tylenol is the thing that I would only recommend as the medication you would use for lowering the temperature, because if you take Advil or any non-steroidals, there's a high risk of complications, and try to avoid that as much as possible. You need to keep yourself hydrated, drink a lot of fluids, and also do not leave home unless you have to go to the doctor. Quarantine yourself, and generally need to stay active as much as you can. Don't overdo it. And as soon as your symptoms start to abate, if the fever is gone for 3 days, and then after that you can get about and not fear exposing others. And generally 2 weeks is the duration that one would encounter in most people who have developed the disease and develop symptoms. Separate yourself from others in the house. If you can, wash hands frequently and sanitize. So these are things that have been stressed over and over again by CDC as well as by almost the World Health Organization. Next, when do you go to the doctor or go to the emergency room? As I mentioned earlier, trouble breathing is one of the things that you need to watch out for. If you get short of breath, then you need to consider calling a doctor and trying to see how bad it is. Persistent pressure in the chest or sensation of difficulty when you breathe in, there's some restrictive sensation in the chest, and that's something to watch out for. Bluishness of the lips and the face, again, that indicates there's lack of oxygen being delivered to your peripheries, your skin, and that again indicates there's a problem. And inability to stay awake can be another symptom that one needs to watch out for. What are the treatment options you have? Only about 20% of the patients have to be seen by the doctors and be hospitalized for worsening disease. And we've been using hydroxychloroquine, which was the initial option that we had. And this is not for outpatient use. A lot of people have been picking up prescriptions and medication and keeping it at home for use. But this really does not help unless you develop progressive illness, such as needing hospitalization. And there's a high risk of cardiac arrhythmia, cardiac arrest, and what's called a prolonged QT syndrome. So my recommendation is that unless you're prescribed the medication by a doctor, I would not take that. The other newer development has been remdesivir, which has been approved recently by the CDC on an emergency approval basis. And this will shorten the duration of the illness. And also there may be a benefit in terms of the mortality rate associated with it. So this now has been made available to our institution, and I think, and as well as throughout the country, initially on an emergency basis. And the federal government has figured out how to distribute it to all the hospitals. And this medication can only be given in the hospital. It's an intravenous medication, and it will shorten the duration and symptoms by about 3 to 4 days, and may lead to an improved outcome in terms of the number of patients who will survive this disease. So basically,
thank you very much, Dr. Nadaraja. Our audience, if you have any questions for Dr. Nadaraja, please type them into the chat box. And once the panel discussion is done in about 15-20 minutes, we will start the question and answer session, and Dr. Nadaraja will be answering those questions too. Our next panel member is an internationally renowned expert on endocrinology and nutrition. Today, he will be presenting preventative and community medicine aspects relevant to COVID-19, starting with the importance of the immune system. Oops, sorry, okay. Dr. Sunil Vimalavansa, thank you for joining us from Sri Lanka. And could you start with the importance of the immune system?
Hello, Chairman. Thank you for allowing us to participate from 8,000 miles away. Aibuan, Manakkam, and welcome. So I'll be presenting in the order in the slide, and there's only one slide actually, so we can go through those topics quickly. And if you get cut off, don't worry, I think you might still get the sound because the Wi-Fi connection is not that strong here. So COVID is
yeah.
an...
Can you ask Sally to do it? Can you call Sally and do it? Yeah. Yeah, yeah. Okay.
Chandran, we can hear you too. COVID can affect everyone from newborn to a centurion. Approximately 70% of the population, mostly the young and even the older people with a better vitamin D status, and therefore having a reasonable immune systems, either get the asymptomatic disease or have a mild flu-like illness not requiring attention, which alluded by Dr. Nadaraja as well. So only a 20% or less actually gets some clinical issues. So let's look at briefly the importance of the immune system, thereby assessing who gets the disease and who's not. So having a better immune system enables to generate antibodies as well as other components of the immune system to get rid of COVID quickly. So this heightened immune system is a clue to staying healthy during the COVID epidemic. It's important to remember, as you and I, we are responsible for our own health and recovery, and that cannot be infused to us by doctors or by hospital. They are only there to provide us supportive therapy. So another 15% develop mild flu-like illness and extend over a week or 10 days with apparent full recovery. I emphasize the apparent recovery because the genome of the COVID-19 also has an HIV genetic component insert should happen, but this designed to weaken the host immune system. So I suspect that this is why the COVID-19 is capable of causing havoc in those with a poor immune system. It's designed to suppress the immune system of the host, which is human. So if this is the case, I predict that there will be a longer-term immune-related complication following COVID-19 in months or years to come when the people are even apparently recovering well. So only about 10 to 12%, if you look at it globally, will develop significant issues needing medical attention. It varies from country to country, but average about 12%. Also important that the children and young adults, although they are getting little or no signs or symptoms, they are COVID carriers. Very important to realize that, so that they can transmit viruses to others, especially the teachers, parents, grandparents, neighbors, and older relatives. So the parents have to be mindful that these kids visiting of their grandparents or going to other places, because they can actually infect others, although they look healthy. So the administrative point of view, it is not just shutting down or opening schools or universities as authorities believe. It's a lot more complicated than that. So next we look at the second bullet point, which is the why tropical countries have extremely low death rates. So there are multiple things, but I'm going to summarize it very quickly. So countries around the equator, including India, Sri Lanka, Pakistan, Malaysia, Cuba, all countries were reporting markedly less prevalence compared to any other country, and the lower death rates than expected compared to those situated in northern latitude. Those are the colder countries. Importantly, a reasonable vitamin D status lead to a less severe illness. There have been dozens and dozens of reports coming each day on this point. Significantly lower death rate in those with the vitamin D, especially in tropical countries. However, one need to be cognizant that there are other key factors influencing these statistics, especially the low numbers of PCR testing carried out, and also, importantly, the lack of PCR and antibody testing in the community. These are not being done in many of these tropical countries. They're claiming that they have a very low rate. If you don't do the testing, obviously you're not going to find the who's infected. So the bullet number 3, let's look at the importance of the community testing, which I just mentioned. There are a couple of numbers to remember. Multiple studies now have reported, for example, the Santa Clara study, city study, and there are many, which they have done the community randomly decided community PCR positive testing and also antibody testing. So this study has found that every one patient in the hospital positive of COVID-19 asymptomatic carriers infected in the community. So this is very, very important. Although we claim that we have 10 patient or 1,000 patient, there could be the 10 to 40 times more infected patients in the community, which you are not detecting unless you do a community testing. Therefore, to get a reasonable estimation for the tropical countries, especially the total reported cases in a country or county, 20 or 25 approach. So we are not detected yet because we do not carry out a single community whatsoever. Only a small fraction of this come to medical attention to hospitals or people come with a fever, but as Dr. Nadaraja mentioned, they are the ones who actually reported in the statistic. So if a moderate number of 25 is used for Sri Lanka, for example, with the average 25,000 infected people but not diagnosed, and the 1.5 death rate, then you can calculate and see the expected death rates in excess of 375 today. Yet the country's reported death rate by the health department is only 10. So why this is big discrepancy of data? So let's explore quickly some explanations. So except in Singapore, South Korea, the other tropical countries, the rate of doing PCR testing is exceptionally small. So if you don't do testing, you are not going to diagnose COVID-19 patient in the community, period. So none of these countries also carrying out the community testing, including the antibody testing. And also, more importantly, majority of the deaths are now occurring in the community. And none of these patients, I would say none of these patients have been tested for PCR. They just die, may or may not have PCR, be actually entered into the COVID citation, are not diagnosed and fail to confirm COVID deaths as the death certificate. I'm not blaming that as a mistake, but that's the way it works. Because if you don't do testing, you cannot include that as COVID death. So due to a fewer number of PCR testing, less diagnoses are made in both alive and deceased, especially in a peripheral hospital and those who are dying, very importantly, at home, which is it's actually increased almost 10 times, tenfold these days because people are not going to hospital. So without sufficient testing, authorities are clueless of what is going on and have consistently failed to leverage the data for strategical planning. Meanwhile, doctors, nurses, and public health professionals in all countries working their best to help people, at times even risking their lives. Meanwhile, senior administrators are, some of them are relying on curfews and lockdown and assuming that that's enough to control the COVID epidemic. Of course, that's not going to happen. So without doing any community tests, as in how those are going to identify just 80% plus people infected in the community and helping them, that's insane. Even with the respiratory symptoms, it's my personal observations in Sri Lanka, despite claims they are not tested for COVID, and therefore related deaths are not accounted. I'm sure that the health department folk doesn't want to hear that, but this is the facts right now. Perhaps such faulty statistics by health authorities are designed for whatever the reason, maybe political consumption. However, the more importantly, the unreliable and markedly underestimate the prevalence of death. It actually mislead in the world statistic. For example, 90% of the COVID-19 deaths occurred in warmer countries, for example, like Australia, were mostly housebound elders aged above 75 years. They had chronic cardiovascular or pulmonary disorders, extremely low vitamin D concentration. We're talking about a less than 5 nanograms. So it's meaningless to try to in small islands like Sri Lanka with the US, UK, Italy, Australia. It's a worthless effort. So bullet number 4, so what are we expecting to happen during the summertime? So it's a good time. Summer is going to happen to US and northern part of the countries. So in America and Europe, the spread will gradually reduce with the arrival of the summer, which is the higher temperature and humidity. This reduction of incidents have nothing whatsoever to do with the healthcare or medical intervention. It's the nature and the behavior of the virus is changing with the temperature and the humidity. That's exactly what happened in tropical countries and why the incidence and death rates are low in tropical countries. In tropical countries, the warmer weather, relatively high, relatively lighter skin colored compared to African Americans, and in excess of 300 days of sunshine results in a lower prevalence of severe vitamin D deficiency. So consequently, the immune systems are better equipped than the winter in the colder climate with COVID, as everyone knows. So bullet number 5, let's look at the briefly, actually I'm going to give one sentence answer to the effect of lockdown and curfew. Because a big thing, if I talk, I can talk an hour on this issue, but let me summarize the one sentence. It is estimated that those countries impose severe restrictions, especially 24-hour curfews. For each reported PCR positive COVID patient, there will be unaccountable 1,000 community deaths in days to come. So remember that thing, but I don't have time to explain that perhaps in the next, another time. So this is my last bullet. Thus, medical care is the reason for very low death rates. The simple answer, unequivocal answer is absolutely no. Medical care is very important for people coming to the hospital. As Dr. Nadiraj said, that's only 12% of the people. And the intensive care is even it's a fraction of that. So, and also studies show that there's no relationship of healthcare delivery and COVID-19 associated death in any tropical country. It is the sunshine and warm weather that protecting people in these countries. So in a small country like Sri Lanka, we could have effectively boost the entire country, 21 million, with the immune system within 3 weeks at a cost of less than $3 million, thus protecting everyone in the country from COVID. But we didn't do that. So rather than, unfortunately, like in US and other countries, because of the curfew, especially, it destroyed the entire economy and the livelihood of more than 60 to 70% of the population that take a long time to regenerate it. So my last couple of points is that there's up to 60-fold difference in the number of hospital and ICU beds per capita, GDP, or the number of doctors per 1,000 population in Asian countries. For example, if you compare the Bangladesh versus Singapore, 60-fold different. So important thing is, irrespective of what healthcare benchmark used, the reported death rate, which is a number of deaths divided by the COVID-19 positive cases, expressed as a percentage, are uniformly low. And there's little difference between tropical countries. So that strongly suggests that health availability of the healthcare is really not affecting the death rate at all. In USA, in each state, utilizing different approaches at times, implementing the contradictory policies from state to state. Unfortunately, many are designed to discredit the current federal and for November election, which this is really pretty in the country first before the measures to prevent 19. I'm referring to affordable and the drugs which are safe to use. So antivirals are not in that category. In fact, there's no treatment is available in the Western, Eastern, United, or any Ayurvedic system. So let me finish actually saying that COVID not a nighttime disease or understand obeying curfew. So curfew had nothing to do with COVID control. The long-term clinical, social, economic outcomes would have been much better, especially in Sri Lanka, in those countries and other countries without curfew. It caused more harm and very little benefit. The low prevalence of COVID-19 and the low death rates reported are simply due to the logistical and natural reason, and nothing to do with the draconian measures such as 24-hour curfews or healthcare intervention or delivery. I know that there will be people have a question and controversial, but these are based on simple fact. Thank you very much.
Okay. Thank you, Dr. Sunil. And again, I want to remind the audience, questions you have for Dr. Sunil, please start typing them into the chat, and Dr. Sunil will be coming back again during the question and answer session and be answering them, and he might answer back into the chat as well. A very important part of the art of how we face this epidemic, our concerns regarding the epidemic have to do with our children. We are very happy Dr. Kottahachi, a renowned and highly experienced pediatrician, is joining with us today. We thank Dr. Kottahachi for his organizational efforts for this too. And we invite him to begin his presentation, starting with the prevalence of COVID-19 among children.
Thank you, Chandana. Mine will be a slightly shorter presentation simply because in pediatric age group, COVID-19 is experienced to a lesser degree. It's about under 2% of all COVID all over the world had been in the child pediatric population from the birth to about 21. Having said that, the symptoms are they are all similar, except very important to remember, symptoms are much milder. You might think the child who is 3 or 4 years old has just a cold, and in fact could be COVID. But the important thing is they can be carriers, especially to their grandparents who might be having diabetes or hypertension or other immunocompromised situations. So that is a risk that you should be aware with the children. But also when to seek medical care, as much as it is most symptoms will be mild, there are also certain percentage up to 6%. In adults, it's about 18 to 20% of COVID patients get into trouble, serious situation, needing hospitalization. By children, it's around 6%. But still, you need to recognize the same symptoms. If you develop shortness of breath or any other symptom peculiar in the pediatric age group, there is a new entity that has been described, first in UK, United Kingdom, later now here in New York, as well as across the country, about 135 cases in the US with severe symptoms. This is not COVID. They are COVID negative most of the time, but this is hyperimmune response, what we call multi-system inflammatory syndrome in medical terms. What it means is children get very ill, affecting many organs, including heart. They also can have fever, chills, muscle pains, sore throat, gastrointestinal symptoms. Then these kids need to be admitted. But the good news is, even though they get very ill, because it's not due to the COVID virus that they get sick, it is a reaction to the late reaction to the COVID virus. Therefore, the doctors can take care of those inflammatory symptoms, and generally they recover. Only I think one death has been reported for this illness, a new entity that have been described in the last 4 to 6 weeks. The other thing is many questions the parents have about children. When should they go to school? And their mental health issues. They are all now at home, isolated. Small kids don't really understand that much, and then they will be very restless, especially the kids with some already underlying problems like autism spectrum disorder or hyperactivity. Then they will be more affected by mental health. So later on in the quick question and answer time, we can talk more about those. So at this point, I would like to mention about a little bit about antibody testing. There was a question earlier about that too. We will talk more about during the answer time. But out of all the tests available out there, I think one developed by Abbott in Chicago seems most promising, about 98% accuracy. It's a blood test. It's only detect whether you have developed antibodies to the COVID that you had 3 to 4 weeks before the actual test day. But that gives information, good information. Number one, it could be protective, even though medical science still don't know for sure whether just because you have the antibody, you are totally protected. But more important than that, it is to know the prevalence from a public health point of view in the society. So when those tests are not very widely available, but they are available though. So whenever it is available widely, I think it's a very good way to go with that as for the testing. We will talk a little bit more about other aspects during the question time. Thank you very much, Chandana.
Thank you, Dr. Kotahachi. Our last panelist joins us from Texas, where he's a professor of psychiatry and is working on the mental health aspects of the pandemic. Dr. Marambage, thank you very much for joining us today. Question for you before you start. Why, we all know that mental health is so important, but why has it taken new proportions? Why has it become so important than during the regular times?
Thank you, Chandana, for inviting me to the panel. And basically, I work as an inpatient psychiatrist at the Parkland Hospital, and Parkland Hospital in Dallas, Texas. And my work, I see about 20% of my patients would be either investigated for COVID or they are COVID positive, partly because I am an addiction psychiatrist, and my population, the drug abuse population, are kind of susceptible to get COVID, and because of their drug-related behaviors as such. And I see like a significant amount of relapse going on currently due to the stressors related to COVID, and we expect that there would be a upsurge of psychiatric issues following this issue because of all the psychological stress that follows it. And I wanted to talk basically about a few things. I broke down my thing into three different areas. The first one is what seems to be the problem. There is significant psychological fear and stress and worry involved in the whole situation. People feel unsafe. There is a lot of what if kind of thinking patterns that have developed. What if I get infected? What if my parents get infected? What if my grandparents get infected? And my, as such. And there are some other issues because of the isolation and the quarantine, general medical conditions and also psychiatric issues get worsened because they don't get regular follow-up with their doctors sometimes, and they are not compliant with their medications, because sometimes the psychiatric patients needs regular follow-up in order to prompt them to be compliant with their medication. And the stress rates are higher among the females, it seems, compared to the males, mostly because, you know, people are confined to the homes. And when you take a home situation, a lot of stuff is handled by females, including caring for their children maybe, and, you know, cooking and whatnot. And then if, in addition to all that, if they have had to work from home, it adds a significant amount of stress on them. There has been an upsurge in increased substance abuse and issues related to isolation and cabin fever, like which affects teenagers and children as such, as well as adults. I think at the end of this presentation or at some point, there would be some helplines added in order for people to reach out if in case there are issues. One thing that I have noted in my clinic settings is that the people are confined to their homes, and sometimes they are in abusive situations, abusive relationships, and they have had to, you know, be in the same room or whatever, confined with their potential abuser, which increases post-traumatic stress as such, and other illnesses. So those are the problems that I have noted. But of course, if there are anything outside of this, the list I have given, maybe we can answer later. And then I would like to think about the precipitating reasons behind why suddenly this has become a significantly stressful situation. Some factors are COVID specific, some factors are not COVID specific. COVID specific factors are that there is no real, you know, specific treatments yet. Dr. Nararaja and the others talked about a few things that are coming up, but the treatment is not fully effective yet. We don't have a vaccine, and the number of casualties keep going up, which leads to helplessness in people. We feel like, you know, we are helpless. The medical, you know, community doesn't have much of a big answer. I mean, we are doing very good actually compared to how we thought before, but still we are not right on top of it. And the second issue related to COVID is that information keeps changing. Every day there is a new finding of the medication that we thought was effective 2 weeks ago has not, I mean, is deemed to be either having a lot of side effects or not as effective as we thought. And routines have gotten disturbed. People have had to adapt to working from home, and children are being homeschooled, which adds stress to the parents as well as the children themselves. They are not, some kids who are used to the kind of structure that they got at school is not getting it anymore. And the parents are stressed out, you know, having had to, you know, do all the homework as such. Then the dynamics of interactions, I have found that certain team members, if you're part of a company and you're working with a team, sometimes the dynamics between the co-workers and the boss is a little different, dealing things over Zoom or, you know, Microsoft Teams or something like that. It's not the same as you being, you know, seated in the same room, where you have gotten used to that pattern and now you have to deal with it differently. It affects medical work as well. In my team also, I have had some issues which, you know, have kind of been issues for us. And then this is a revenue reducing pandemic in that we are losing money. Companies are not doing too well. Businesses are suffering, which can add to a lot of stress related to job security and things of that nature. So these are some of the precipitating reasons that I came out with. And then I also thought about what can we do? How are we going to, what are the possible solutions maybe? So I went through some CDC guidelines as well as WHO guidelines, some research done through Columbia and Oxford researchers, and came out with a list of different stuff that I thought would be useful. One thing that I found was to limit the news information about the pandemic. Like we are in this, in the middle of this, where we are hearing bad news repeatedly, and dramatized bad news can be disturbing. So there has to be some news and social media related discipline that we try to install in our houses. so that we limit the number of information, because excess information and keeping track of numbers does not help always. And there is only so much you can do with it, because we have to resort to the usual stuff of, washing our hands and keeping the social distancing and wearing the mask and, that kind of thing, isolating yourself if you're sick. Beyond that, nothing can be done. So however much information you have, it doesn't make that much of a difference. You need to have information like in forums like this, maybe medical panels and such, but then routine news and social media feeds sometimes can add to your stress if it is excessive. And then keeping a weekday and a weekend schedule would help, because now everything has changed. Taking care of your body in terms of regular aerobic exercises, yoga, gardening as such, because you cannot do regular aerobic exercise as we used to do. We cannot go to the gym or anything. So maybe yoga is a good alternative. Gardening is a very good alternative in that you do a lot of physical work involved, and then there is a lot of mindfulness involved. Improving diet is an important factor with the medical guidance given by the doctors previously, with vitamin D and C, and then improving the diet to keep healthy would be important. Having good sleep is important. And to unwind, using Zoom and Hangouts and virtual dinners might be helpful. I have found it very helpful for myself. I hang out with my school friends frequently, which has been very useful. And I'm sure people are doing it otherwise as well. But to unwind and keep the connection through the abundant online sources that we have is a useful thing to do. And then about the kids, it's a very, very significant issue, I think, which is kind of underplayed a little bit, or we haven't paid enough attention. This is a time maybe we can be role models to our kids, and take on the parenting role a little bit, because whether we like it or not, the system has taken over. They are in school, and the system takes care of the kids. Not that I'm not saying that we are bad parents before, but now this has given us an opportunity to be with them more, and maybe provide some role modeling opportunities, rethink and adjust some of the rules around the house and such, so that they are not stressed out. The same rules as how it was before might not be applicable now. It has to be changed a little bit maybe, in order for them to feel relaxed and happy. And then there is another concept of creating social bubbles, which is called quarantine, TEA. In the sense, you either create a virtual or a physical social bubble, right? Without isolating yourself in your own bubble, you try to create a social bubble. Virtual bubbles are easy to do because we have Zoom and as such, and then we have trusted, our school friends or the whoever. We can have a virtual hangout, like I mentioned before. But the physical hangouts also can happen sometimes, so long as you keep social distancing, keep it for less than 10 people, trustworthy people who will be very responsible about if they were to fall sick as such. And sharing entertainment like singing songs and sharing films as such, and then delegating tasks, sharing responsibility regarding meals as such. So we have to move into this, because I think, it looks like this is going to drag on for a little time. It's not going to end pretty soon. So we better get adjusted around it. And then I also thought about thinking outside the box.
Yeah. Dr. Maraviki, sorry to interrupt, but this seems like thinking outside the box seems like things which were reserved for people like Steve Jobs or that kind of people. The normal human beings like us, what does it mean for us to think outside the box in a situation like this?
Yeah, thank you, Chandana. Actually, Chandana brought up, I did just put it as one point and I didn't want to elaborate on it because it is a big subject which I don't know whether I can elaborate on adequately in this session, but I'll try to do my best. So we talk about thinking outside of the box, like in cliches, and like, it is there. So if I think we did a little presentation around it. You can see a box. This is not a box, this is a square rather, but I modified it to say the problem with the box in most situations is that there are boundaries in the box, and generally people don't pay attention to the boundaries of the box. What are the boundaries of the box? So there are physical boundaries in a box. And if you can move on to the next bullet point, moral and ethic boundaries. and then there are industrial standards and legal boundaries, and also technical and technological boundaries. Let me explain what that means. So like if you are in a box, like if you are working in a certain situation, there are certain constraints that you have to work around. Like, for example, in a company, there would be legal and industry standards, physical boundaries, and moral and ethics standards, and technical boundaries. For example, if you're in a restaurant, the food is generally served inside the restaurant. That's the physical boundary. So you have to go beyond that physical boundary now to serve meals to people at home or something. So that is thinking outside of the box in that sense. So moral and ethic boundaries are, of course, it's not fluctuating that much. Legal and industry standards also doesn't fluctuate. But technical and technological boundaries, we can kind of modify our thinking around the technical knowledge that we need and as such. Now, the size of the box also can, like this is a box. If you can go to the next slide, please. The box can change, the size of the box can change sometimes in certain people. The bigger the box, the bigger the area that you are functioning in, the lesser anxiety you might generally have. I'll give you a brief example. If you are going on a flight to Sri Lanka, let's say, there is when the plane takes off, of course, the pilot is the one who is handling the whole thing. But then after some time, when they reach the altitude, it goes on like autopilot. So we have this situation of an autopilot in our own brain. And generally, when things are functioning within autopilot, the box kind of generally shrinks. And then suddenly, if there is turbulence, the pilot has to kind of, take over the controls and let go of the autopilot, as far as I know. And then they have to handle it by themselves. So right now, COVID has brought us to a situation like as if we are in a turbulent situation right now. So we have to take control. And if we have a very small box as determined by automatic brain, then it's going to be difficult for us to expand it unless you have the knowledge and the capacity to expand it back to the normal place. If you go to the next slide, please. So I want to talk briefly about automatic brain functions, which I talked about. Now we have an automatic part to our brain. Like anybody who has driven from home to work, there is automatic brain function. It is created for economy of thinking. The brain is designed in such a way that we don't want to think all the time. We want to assign some functions to automatic thinking. But generally the bad thing about that is that it will box us in familiar patterns which are difficult to break through. It creates a tunnel vision, like a myopic tunnel vision. It creates a smaller box, as I showed in the previous slide. And in crisis situation, if you are with a small box, if you are in a small box, then you tend to feel helpless, hopeless, and anxiety and depression if you are not capable of getting out of the automatic brain and using the other part of the brain. So why do we need the out of box thinking at this stage in our life and the way things are going right now? It looks like the answers to the problems keep changing. Like we had viral infections going on for a long time, but suddenly here comes a new one which nobody has any answers. So it can happen again. It has a tendency for this to repeat. Therefore, we need to create out of the box thinking so that we are not on automatic function. And thinking outside the box requires basically break away from the automatic brain and to have a left and the right brain synergy so that you can start thinking creatively. So this brings us to left brain and the right brain, how they function. Left brain, it is thought to be more connected with the automatic brain, and it is more analytical, mathematical, linear, and logical. It creates a very linear, logical world vision, and 90% of our population is a left brain dominant function. We are right-handed, and then they are the ones who can argue. They are the ones who can bring logic because they have at their disposal certain tools like being able to talk, and the voice and the voice centers are situated on the left side of the brain. But the right side of the brain is generally not like that. It is more creative, it is more intuitive, more innovative, problem solving, connects with the unconscious part of the brain, and as such. So the right side of the brain is a little different. It is the one who can create innovative ideas outside of the box kind of vision. So it is all about developing the right side of the brain. And generally it is seen that the people who are into liberal arts and has a good taste in, you know, music and as such, they generally have a better sense of the right side of the brain. People who are practicing more mindfulness, as given in our religions, including, Buddhism in particular, has a lot of right brain function. I will give you one example. Can you go to the next slide, please? So if you have the boundaries, I will give you a very quick example that we can all relate to outside of the box thinking. There are lots of outside of the box thinking, like if you take situations like how Uber was created, that they thought, once somebody thought that, you know, we don't have to own the taxis to run a taxi service, Uber was created. But I want to go to a situation we can all relate to, where Sri Lankans came out with an innovative out of the box thinking in the 1996 World Cup, where, you know, our cricket captain and, Duleep Mendy's Arjuna Ranatunga and Dev Watmore came out with this concept of playing fast during the first 15 overs of a match. And they basically used all these barriers. There was no legal or moral issue with, doing that. Batting fast in the first 15 overs. There was a physical advantage to it because most of the fielders were within the ring. There were very limited fielders outside the ring. So they made use of that situation. And the technical advantage they took some really innovative players who can play on over the top to come and open the batting. So that was a brief example that we all can relate to, where some Sri Lankan, it basically led to a paradigm change, I think, in 50 over cricket, in that we are capable of, thinking outside of the box and creating new things. I'm only saying this because it is a kind of thinking that people need to develop when we are facing a crisis, that we need to do a lot of creative thinking outside of the usual box so that we can move on in our careers and we can promote careers for our kids. So it is important for our careers and our education. I thought it's an important thing to point out. That's all I have, Chandana.
Okay. Thank you very much, Dr. Marambike. And now we are going to, we will be starting our question and answer session in a minute. But now we are going to go to New York, and Ambassador Shenuka Seneviratne will be joining us with some brief remarks.
Thank you, Chandana. Good afternoon, dear panelists and my sisters and brothers of the Sri Lankan community. My heartfelt appreciation to the Ananda College Old Boys Association, East Coast, USA, for organizing this timely community briefing on the different aspects of the ongoing pandemic, which has caused havoc in our daily lives. This thoughtful event is a demonstration by the Old Boys of Ananda, living by their school motto of Appamado Amatapadan, where heedfulness and punctuality lead to the ultimate. In this context, undoubtedly being mindful of their responsibilities even towards others, in this instance, the Sri Lankan community here, has resulted in this valuable community briefing on facing the pandemic today and preparing for tomorrow. How more heedful and punctual can these old Anandians be? All of you are a pride to your school and Sri Lanka. A big thank you to the panelists for volunteering your valuable time for this briefing, which has, and it has also provided much education by leaps and bounds to me on the virus, and hope this is only the first and there will be more to come. As stipulated by the WHO, Sri Lanka is currently at stage 3 of the countries experiencing cases of clusters in time. In Sri Lanka, the robust healthcare system, strategic measures, and public awareness have also contributed to the containment of the virus spread. This success seems to have found resonance here in the US among the Sri Lankan community, considering the number of requests we are receiving for them to return to Sri Lanka based on a perception of the country being a safer place than here in the US. All these requests have been transmitted to Colombo to be processed for repatriation. We need to await instructions from the ministry on those eligible for repatriation at any given instance, which is done by category. A batch of students were repatriated beginning May, and to date, we are awaiting for any further openings. We understand the compelling reasons of these persons who wish to return and to whom this process may seem slow. However, such repatriation has to be done in accordance with available quarantine facilities and other requirements. The permanent mission in New York, though telecommuting since mid-March, has established 3 emergency phone lines if required, and the information for repatriation processing is also available on the website. There is also skeleton staff present in the mission each week on a Wednesday. Due to the pandemic, for the welfare of the Sri Lankan community, on the initiative of the Sri Lankan Medical Association of North America, SLAMANA, 8 doctors have voluntarily offered assistance and medical advice, details of whom are on the mission website. Thank you very much for such magnanimity. While pledging the mission's continued service to the Sri Lankan community in the New York tri-state area, I wish all of you good health and happiness. As you well know, Sri Lankans are resilient people, so let us rally in strength and build back better a prosperous motherland. Thank you.
Thank you, Your Excellency. Now we are going to start our question and answer session. Some of the questions which have popped up in the chat had already been answered. Depending on how important the participant felt or using a bit of judgment, we will we will bring some of those questions to the panelists as well. The first question goes to Dr. Nadaraja. And before I get to that question, Dr. Nadaraja, there had been several questions which go into technical, serious medical details, and we understand there are several medical professionals in the audience as well. We will probably skip those questions, many of which Dr. Nadaraj has already answered through the chat as well. So let's go to a question several people have asked, and in this chat as well as among ourselves. They have to do with having had the BCG vaccine as a child. What can you elaborate on? I'm sure you are familiar with what they are talking about. Could you please elaborate, Dr. Nadaraja?
Well, there has been some speculation, or at least thinking, that people who've been immunized against with the BCG vaccine, which is used for tuberculosis prevention, may provide some immunity against the COVID virus infection. I mean, it's an antibody response. I guess the question is, how effective is the, it's based on a T cell, which is the different type of cells. You have B cells and T cells. The B cells produce the antibodies, and T cells also are involved in the immune system. So there's been some reports of the people who have had the BCG vaccine maybe at a of getting the infection. So wait and see if there's enough data. Obviously now we don't immunize, I mean, people don't get the BCG vaccine anymore because tuberculosis is not that prevalent at this time. So I think that's pretty much what it's, what we know about it.
Thank you, Dr. Nadaraja. And there were, again to Dr. Nadaraja, there have been several questions, some very medical and technical questions, some of which you have answered. I will not try to judge which one of them are important enough, but you have obviously seen them. Could you talk a little bit about those questions which had to do with, mostly which had to do with whether people should be using, the hydroxychloroquine. Yeah. Yes.
So,
Thank you, Dr.
I think Donald
Please use
Trump
your
was,
judgment as to how much detail you want to go
yeah,
into.
I mean, Donald Trump is one of the original people to proponent of the hydroxychloroquine in terms of treatment. And the studies were based on a small study that was done originally. And the data was questionable. And clearly it may have some benefit. We really don't, we're not sure if that is the case or not. And the combination of the hydroxychloroquine with the azithromycin, which is a common antibiotic that's prescribed, which is also effective against Legionella and some other smaller organisms, that could prove to be lethal. We were administering that combination in the hospitals early on in the pandemic. And there were some patients who did develop cardiac arrhythmias. You have to monitor their electrocardiogram and make sure they don't have what's called a prolonged QT syndrome, a prolongation of the QT, which can predispose to major arrhythmias. So we've now gone away from that, and we still do use the hydroxychloroquine because we did not have any other options. But at this point, we may switch to just using remdesivir, which has now become available, early on. But again, this is only used for patients who are in the hospital, who have severe respiratory issues, and what's called a cytokine storm, which happens about 6 days into the illness. Initially, you get the viral infection, and the body basically fights. And the majority of people who are immunocompetent, the body will fight off any type of, if you have a cold, influenza, any kind of viral illness, the body is pretty good at dealing with it. But then the majority of people who are either diabetic or morbidly obese, their response is not as good. Actually, they get an overwhelming response, the immune system, which basically attacks the whole body. Instead of just the virus is also that the body does not recognize that it's just the virus that it's attacking. It attacks all the cells in the body that have the virus, leading to this inflammatory cytokine storm, which happens about 6 days into the illness. So that's the thing that leads to the deterioration and respiratory failure. That only happens about 5% of the patients who get it, or maybe even lower than that, who end up in the intensive care. So, and it's rare. It's not a very common incidence, but again, it can be critical.
Thank you, Dr. Nadaraja. The next question, there have been several questions regarding children, kids' health. So this goes to Dr. Kottahachi. Is there a direct correlation between COVID and the recently recognized Kawasaki-like disease found in children?
Yeah, as I mentioned in my brief presentation before, yes, there is. Here's how it, so far we know from the studies from London and also from New York. It is, those patients who get it, seem to get it, they were get it around 4 to 6 weeks after getting the COVID. So what they, at that time of diagnosis, they are very ill. They get persistent fever, rashes, and organ failure, sometimes 2 organs, including coronary arteries. So there's a correlation, but at that point, they are not positive for COVID, but their antibodies are positive. Some of the kids who are tested. So meaning that they had COVID 4 weeks ago, this is a hypersensitive, hyperinflammatory reaction to the COVID. The good news, if there is any, is that kids, this can be helped by medical intervention in ICU setup to treat the inflammatory disorder. So yes, there is correlation, but there is also a little hope with that. By the way, I should mention, this is a very rare, but still when it happens to you, your child is 100% for you. So therefore it's important for everybody to know. And if these kids were to develop symptoms such as this, you cannot wait in the house, you need to go. The symptom I mentioned, persistent fever, rashes, and red eyes, skin peeling, Kawasaki-like symptoms. You need to get to the hospital as soon as possible, then the outcome will be good.
Thank you very much, Dr. Kottahachi. There have been several questions for Dr. Marabeke. I will try to present some of them. And one question, the first one, the most frequent one was Dr. Maramike. What advice can you give people who may notice a friend or family member struggling with their mental health during these times? What can parents do for their children and vice versa regarding mental health?
Yeah, great question. I mean, it all depends on the situation. If it is like a severe mental illness and somebody is suffering through severe mental illness, then I think the best thing that can be done is to trace down whoever is following that patient psychiatry wise and get through to those providers. We are on high alert to respond to all questions regarding any patients that we are following. Every other clinic is also like that around, at least in Dallas, I'm sure rest of the country too. So they will respond very quickly to situations like that if it is an active psychiatric patient taken care for in a clinic. But let's say it's not like an active psychiatric patient, it's a general concern that you have somebody is getting depressed. The best way to go around would be to go through their primary care physicians if there is anything as such. Otherwise, you can reach out to the local community hospital through their helpline, and then something will be done. If you reach out to the primary care physician, generally there would be a call back by either a physician or a nurse practitioner who will address, take them through a certain number of questions and then decide whether it's a severe enough issue that they need to present to an emergency room. But those are the options. There is no, in extreme cases, like if somebody is suicidal or if somebody is being abused, then of course you need to call the helpline so that they will take care of the matter. They will send somebody to your house immediately.
Okay. Thank you, Dr. Maramiki. There had been a follow-up question, slightly more detailed or technical questions. I will combine them and ask you. One of them is regarding, speak a bit about Maslow's hierarchy and needs in relation to mental health during these times. And the other one, going in a different direction, do you see mindfulness practice as a potential alternative?
Yeah, okay, let me talk about the mindfulness aspect. I touched on it in my presentation. Mindfulness is seemingly very beneficial to counter anxiety and depression. That basically takes you away from the automatic brain into, the synergy between left and the right brains. And it is, there is enough research evidence to say that it is very, very beneficial, relieving anxiety and depression. And basically living in the current moment and, observing your thoughts is very important, and not taking your thoughts as facts. These are all different mechanics through which mindfulness can be helpful. So mindfulness is definitely a proven beneficial thing for anybody to engage in. I mean, I practice it myself. I think it's very useful. The Maslow's hierarchy of needs, basically you have, the basic needs, the physiological needs, and then the security needs, and then you go up the hierarchy of needs. So the thing I want to deliver in a quick sentence would be that if you haven't taken care of the bottom of the pyramid, you cannot work on the top of the pyramid. For example, if you're not physiologically getting your needs met, and if you're not having a safe place to live, it's very difficult to work on higher things like, achieving educational targets and such things as such. You can research the hierarchy of needs, you will see a pyramid. And generally people focus on the top of the pyramid because everybody wants to achieve big things, but then they neglect the bottom. If you neglect the bottom, if the bottom is not taken care of, then the top can fail. That is the point I want to deliver. And sometimes this kind of confinement, and then now we have a little time in our hands, is a time that we can work at the bottom so that the foundation is very strong, so that you can build upon.
Thank you, Dr. Maramike. The next question goes to Dr. Vimalavansa. Several people have inquired, how can they improve their vitamin D levels, whether they should go the supplementary route, or how can food intake can help with that. Could you answer that question, Dr. Vimalavansa? Salis, Dr. Sunil, he's on mute. Hold on for a second, Doctor. Yeah. Dr. Srinivasa, please, can you please speak again? Now you're not on mute.
So it's a great question actually, because let me address the two different ways. Vitamin D is essential for us to live. So if you don't have the vitamin D, you have the exactly opposite. All the system start malfunctioning, all of them. So in a normal circumstances, what you need is a daily supplementation of getting some vitamin D to the sunshine. But in the COVID situation, you have not such luxury of the time to develop a gradual immunity. So in this emergency situation, you're going to need a larger quantities, what we call the boosting dose or the loading dose of vitamin D to bring the immune system up and going within about 36 hours to and 3 to 4 days basically going to take. Higher the dose, the quicker the response of the immune system. So the beauty of that actually, if you kick the immune system, get going, the chances of getting into complication with the COVID will be significantly less. Actually, the correlation with the higher the serum level of immunity, lower the complication rate. So it's simple as that. So how are we going to get that immune booster through vitamin? One is, of course, I'm in Sri Lanka, we have 340 days of sunshine, except for yesterday we were raining. But I generally go out and stay in the sunshine and do some work or meditate or do exercise for at least 30 to 45 minutes between 10 and 12 in the midday. So generally getting the maximum benefits from the sun, which is the UVB rays, is the best time is between 10 a.m. to 2 p.m. That time the angle of the rays coming from the sunshine actually penetrate the skin. So, but usually in tropical countries, it's very difficult to stay in the sun after midday. Therefore, we generally advise to stay in sun between 10 and midday, maybe 10 minutes intervals to try and get minimum of 30, but higher the better. So another issue actually unlike the people with the white skin, the darker the skin, going to take a much more longer time to generate that amount of vitamin D through the skin. And it's not that great. But if you do daily basis, certainly you can get that benefit. But again, for emergencies, things like a COVID, that's not going to be the big help to overcome the issue. So this situation is much better off taking the larger dose of vitamin D in the range of 50,000 once a week, or sometimes 50,000 daily for 5-6 days. And then we can get back to the daily dose of something like 4,000 international units per day as a maintenance dose, at least for the next few months until the COVID epidemic is over.
Thank you, Dr. Vimlavansa.
Yeah, sure. Go ahead.
Sorry.
Fine. No, that's fine.
Okay. Yeah, we are sort of getting towards the 1:30 mark, and we should be wrapping up soon. But just one quick question, one more question which came up in the chat, and any one of you could answer if you think you know the answer. And someone wants to know, would living by seaside help? Now that probably is they're thinking about New Jersey, New York, the East Coast area. But if you may want to enlarge the question, does the location, do you want to move to a different place? Any one of you who would like to answer that question?
Sunil, you might be able to say something, but I haven't seen any data on that, except to say that we are in seaside, probably because of the breeze and so forth, you're thinking that it's cleaner around the ocean, plus the factor that Sunil just mentioned, sunshine. Other than that, there is nothing addressed to in the scientific literature on that.
Okay.
Am I correct, Sunil, on that?
So it seems, yeah. Thank you, Doctor. I mean, I threw up that question just to show how many different kinds of concerns and questions our community has. We may not be able to answer them medically. There may be no answers, but I believe today the four of you did a wonderful job answering the community's questions, their concerns, and we will continue to do so. As Ambassador Sinivaratna mentioned, this is not going to stop here. We will have several more sessions coming up. Want to thank the panel once again. Thank you for joining with us. This session was recorded. We will have it edited and have it available probably on YouTube. We will let you know how to contact or ask questions from these medical professionals and others in the coming during the coming days. Thank you once again. Then continue to stay safe and enjoy the nice weather.
Thank you.
Thank you.
Talia, could you?
Chandana, do you want me to end the meeting?
Yeah, Salia, could you end the meeting, and then we will discuss how to go about the record and everything.
Okay.
But if anyone wants to stay and discuss, that's fine.
No.
Yeah, Salia, we still have 45 participants. So if you end the meeting, I think that would be the best thing to do.
Okay.